the first day of school, your kids are too excited to sleep late. But after today, getting them out of bed can be a real struggle. You know that. They may be tired, but you don't want them to be tardy. Well, now there's a new recommendation from the American Academy of Pediatrics about sleep and school start times. So here to help us put this in focus tonight is Tara Snyder from Start School Later. She's the CEO and founder. Thank you so much for joining us.
Oh, you're welcome. I'm happy to be here.
You're talking about the early start times. My daughter was up at 5, excited to start today.
Right.
But for some kids, the reality is 5:45 in terms of getting up to make a 7:17 bell.
That's right. People sometimes forget that when school starts at 7:17, the kids have to be at the bus stops maybe at 5:45 or 6. The kids are also, some of them have to walk a mile to the bus stop. So we're talking about waking up at 5 in the morning. If you're going to get 9 hours of sleep, if you can do basic math, you've got to be in bed at 8 o'clock. Now, if you're 16 years old, that's not very realistic.
That's for
it's not going to happen.
Elementary school. And now you have the new recommendations from the Academy of Pediatrics that pretty much support this 8.5 to 9.5 hours sleep.
They completely support it. And what's really wonderful is that actually doctors, sleep scientists have been telling us this for probably 20 years. You know, kids do need this much sleep, and they can't get it when school starts so early in the morning. So what do? Well, obviously, you know, there are things you have to do with your kids. You do have to enforce bedtimes to some degree. You have to make sure they don't stay up on the electronics. Basic parenting. But at a certain point, you can't get a 16-year-old to bed at 8 o'clock. You also have to, we have to put our kids to bed at healthy times. We also have to run schools at healthy times.
Right.
That's our duty as a society. And the pediatricians are saying that's true. Sleep's a huge problem in teenagers. It's a huge public health problem. And a major way we can solve it would be to return our schools to more normal times.
Now, I know the governor heard some of your concerns last year, and now they're doing a study this year. What do you think that's going to determine? Well, probably what you already know. Well,
Maryland's study is really a historic landmark study because it's really the first time a state has decided to look at this issue and say, we know this needs to be done, but how can we help our local districts do it? Because the problem really hasn't been, you know, should we do it? Even though some people, I'm sure some people listening to this will think, oh, come on, those lazy kids, we don't need to do it. But anyone who really studies the issue, any health professional, educator will say we should do it. It's just hard. And this study is the first time we're bringing all these stakeholders together across the state, from the health community, education communities, sports people, transportation people, and we're saying, how are we going to ensure safe, healthy start times for the kids in this state? How can we solve this problem?
So playing devil's advocate here, I know at least from the Anne Arundel County Public Schools have said that there's a concern about the trickle-down effect. Starts later, then you're going to have kids coming home in the dark. You're going to have to spend $8 million to change the whole busing system. What do you say to that?
This is, you know, this is what has stopped change all the time, are these fears of what will happen if we move schools to a later time. And what's so wonderful now is that there have been studies out of the University of Minnesota, out of Children's National Medical Center, all over the country again and again, that when schools do change, and this has happened all over, or schools that have never changed, none of these things actually happen. Schools have found affordable, feasible ways to run their classes at safe, healthy hours, and everything adjusts around the schools, not vice versa. They've even found ways to do it cost effectively, and sometimes at low or no cost. Now, it might cost money, but if it does cost money, that's a decision we make where we say we're going to invest in our kids. I mean, we do invest in our kids. We pay to heat the schools because we must. Right. We pay to run schools at safe and healthy times because we must. And when we start thinking that way, we will, and that's where the pediatrician's coming forward and saying this is a health issue. It's really going to help the movement.
Okay. I'm going to cross my fingers for you.
And for all the kids.
Definitely. All right. Tara, thank you so much for coming in. We have more details on the study from the American Academy of Pediatrics about starting school later and why cost is also a concern when it comes to switching the start times. You'll find that right there, abc2news.com. You'll find it in the top stories section.